help fixing your sciatica and low back pain? I got you. I'm Dr. Norris Goldberg, and I'm the owner here at Koru Chiropractic Care. We are a corrective care office and specializing in NUCA, which is an upper cervical technique. And today I want to talk to you about sciatica and really what I'm going to call the 5 most common causes of sciatica. And in no particular order, they are piriformis syndrome, glute pain, referred pain from your glutes, nerve entrapment, sciatic nerve entrapment in particular, spinal subluxation, and disc herniations or disc bulges. And I'm going to show you today how to fix all of those. So let's start with some simple stretches for the hamstrings and the glutes, as well as the IT band, okay? So the first stretch that I like to do is a nice forward fold, really hinging at the hip joint, right? My back is nice and flat all the way up from my neck through to my tailbone. And I'm really just feeling that nice stretch and pull through the legs. Both knees are pretty much straight, but I'm not trying to necessarily force them into hyperextension. And I should again feel that nice stretch on both sides of my legs and the back of the legs, with my back being nice and flat and really pulling my belly button up into my spine. So again, my back should look totally flat, and you just go as far as you can go. What I don't want you to do is try to go as low as you can go, but then round your back. That's not really the purpose of the stretch that I'm trying to show you today. So after you do that for about 30 seconds, I'm gonna have you stand up, and then you're gonna go back down, but this time I want you to keep one knee really bent and the other knee straight. The leg that is straight, put the majority of your weight into that leg. I'm really driving through the leg, putting the weight into my big toe, from my big toe all the way up to my hip. And what I feel is a really nice stretch through my whole glute maximus muscle here. And again, my back, I'm not necessarily rotating when I'm doing it, although you can. Sometimes you can, put an elbow into that knee and get your arm up to the sky. That's even better. That's more of an advanced move. But even just hanging right here, if you're really stiff, even if it's just right here, again, I want your back to be really flat. Don't round in the upper back in particular. In your upper back and neck, that's just gonna cause your lower back to potentially bulge in the discs. Okay, so here's the third stretch, and I call this one the curtsy. So what I'm gonna do is actually cross over the leg that I'm trying to stretch. I'm gonna put my weight into my knee, and just like the last one that we did, really put a lot of weight into this big toe, all the way up across through into the hip. This one, you're not gonna feel it through the whole back glute muscle, more down the side or even the front of the hip a little bit here and to the side of the knee right there. That's your IT band, and the muscle is really up here, so we need to stretch right here. And so what I'll do is I'll stretch, put a little bit more weight in here, and I'll even let my hip kind of wiggle and waggle this direction so I can really find the most resistance. Today, for me, it feels best to push back about 45 degrees. Sometimes it feels better just to go to the side. So really find that resistance and lean into it. With all of these stretches, I want you doing 30 seconds per side. All right, so the first 3 stretches I love because you can just do them anytime, anywhere, whether it's in the gym, the workplace. And that for me was really important. After I broke my knee, I needed to be stretching throughout the day. And so I couldn't always get on the floor and do these exercises or stretches. But what I want to show you is one more stretch for the glute muscle to help with some of the referred pain that you can get into the hip and the low back. And for this one, you're going to want to use a yoga block. So one of the stretches that I've been taught and even been seen and taught in yoga classes is to do a figure 4 stretch where you cross over your shin over your knee and then you reach through and grab your ankle, or sorry, your back of your thigh here. And while this is good for stretching my glute muscle here on the bent leg, the problem that I don't like is look at my spine, I'm all rounded, and if I try to put my head down, then my hips come up, and maybe that's just because I'm stiff and some people can do this easily, but for most of my patients, I don't think they can do this properly either. So I'm gonna show you how to do this properly for your spine and also get the maximum glute stretch. So take the yoga block that I just told you about, put it under your foot here, and then cross over your knee. And now you don't have to hold the leg up. I have my back and neck totally relaxed. My hips are flat on the floor, and I can just focus on pushing this knee towards the wall. And I'm getting a nice deep twist and stretch through my hip joint, and that's gonna feel awesome for a nice achy hip. All right, next we're gonna talk about the second most common problem with sciatica and oftentimes even low back pain, which is piriformis syndrome, okay? So I wanna show you how to work this piriformis muscle and how to make it feel better. So a lot of you have had me stretch this muscle in the office, but you can do it at home. If you just take a band or even a belt and put it around your foot here, and then lie on your belly with that hand reaching back. And what you want to do is just squeeze. If I'm stretching my right side, I want to squeeze my left glute because that's what keeps my hip into the floor. I don't want to stretch this muscle and have my hips come off the floor. So first and foremost is the hip stays nice and on the floor, my knees stay together, and then I just use my arm to pull that out to the side, and I feel a really nice stretch right from my edge of my tailbone here right over to the side of my hip. And that's your piriformis muscle. It's a very small little muscle, but it can cause a lot of problems if it gets really tight. So stretch, and I usually go for about 10 seconds. And then what's really nice, especially if you have an elastic, is I'll push my foot back towards my other knee for about 3 seconds, and then I relax and I bring it out. Oop, again, keep that left glute nice and tight. And now I let my hip relax and I can go further and further. And again, then I squeeze in and then I relax, and it just starts getting more and more relaxed on the side that I'm stretching. If you need help, you can have a partner actually hold your hip down and then push that other arm back or other leg back and forth. All right, next we're going to talk about another very common cause of sciatic symptoms or sciatica and low back pain, or even referred hip pain, and that could be nerve entrapment, particularly of the sciatic nerve. Okay, so what I'm going to teach you is a quick nerve flossing technique. So this is a nerve flossing exercise specifically for the sciatic nerve, and what you're going to do is do keeping one knee bent and put one leg out with your toes up. You're then going to hinge at the hip, right? So my back stays nice and flat and my leg is nice and flat, giving me a lot of stretch through the hamstring. So this is what most people would do for a nice hamstring stretch. In rugby, I used to do a lot of like this, we call them little toe touchers or toe sweeps. This is great just for stretching the hamstring, but what we're focusing on is the nerve. And so what happens is when you tuck your chin down and then you look up, you're actually lengthening and shortening the spinal cord and the spine. So via really just the neck, but because it obviously attaches at the top of your neck and then down at the tailbone and really the toes, when you do this, it's really pulling that nerve up and down. And so whether it's stuck up in the glute muscles or the piriformis or some of the tissue back here, or maybe even the back of the hamstring, or perhaps even the back of the knee or throughout the calf muscle, we don't know where that entrapment is necessarily, but if there is entrapment, if there is a fixation of that nerve, doing this chin tuck is going to glide that nerve through the tunnel the way it's supposed to go, and it's going to make it feel a lot better. And just lots of times that just takes that little edge or irritation off. Okay, so the final and most common issue that I see in my practice that causes sciatica and low back pain would be a spinal subluxation or misalignment, which would then typically result either in a disc bulge or a disc herniation long term, because those things really take either a very traumatic injury or chronic wear and tear, and then much more of a subacute injury like lifting a laundry basket, right? So again, really traumatic, like a violent car accident, or wear and tear over time, and then you bulge a disc by doing something very simple, the old analogy, like the straw that breaks the camel's back, okay? And so I'm not gonna get into the disc bulges and herniations. The way I fix that is hands-on treatment, doing a lot of exercises and stretches. You can check out all the channel videos that I have here and see how to fix disc bulges specifically. But what I wanna tell you about specifically is how to identify, do I have a spinal misalignment or subluxation? Because as a corrective chiropractor, we really look at this more specifically and more thoroughly than just a typical traditional chiropractor where you're pretty much just going to show up, they maybe feel your back a little bit and then just do a bunch of cracking and popping, and essentially if it feels better, it's successful. Not that I don't want my patients feeling better, but we use a lot more objective measurements to determine, one, do you have a subluxation, and two, did we correct the subluxation with the adjustment, which I think is super important. So here's 3 ways you can determine if you have a potential upper cervical misalignment. By no way are these measurements definitive, but it at least gets us started in determining if you have one. And then the next step would be honestly to come into the office and have me do my full evaluation, which includes structural x-rays. Okay, so the first clue is to look at your behind, have someone take a picture of your spine and your back, and you're gonna look at the folds, either where your love handles meet your ribs, or even just kind of where that curve is, that hourglass shape if you're really lean, and see if one hip looks higher. And especially if you have any, folds, which most people do have a little bit of, skin deviation going on there, you'll see one side looking more indented or higher or lower than the other. So the second clue is a leg length discrepancy. So if you're lying flat on the ground, and you could reset your hips by just doing a simple hip bridge, put your feet flat on the floor, lift your hips off the ground, put your hips back on the ground and your legs long. And if your ankles or your heels are at different lengths and you have to have someone help check this, that can be a sign that your hips are uneven, or that can be from either your pelvis and low back being out of alignment, or even from your upper neck being out of alignment, which I can explain in another post. And the third clue is to take simply a selfie, like a headshot, and look at the alignment of your top of your ears, your eyebrows, and then the center of your head going right down through the nose, through your chin, and then what's called your episternal notch, which is just right between your collarbones here. And that should line up perfectly straight with the eyebrows and the ears being level. But a lot of times people are standing maybe a little misaligned like this, or like that, or whatever it looks like. And that is another clue that you have an upper cervical misalignment that I can fix. Okay, so hopefully today's video will help you solve some of your sciatica and low back pain problems. If you do those exercises and stretches and they feel a lot better, then you're probably on the right track. And I would say just continue doing that for a daily basis until that sciatica goes away. But if it's not going away and you take those photos and you realize you may have an upper cervical misalignment, I would really encourage you to find a corrective care chiropractor, someone like myself, of course, who can help you. They're gonna do a really thorough assessment and really figure out how to best fix you with a combination of adjustments to the spine, rehabilitation exercises to strengthen the core and the postural muscles, and even sometimes things like traction, okay? So these are approaches that we use at Koru Chiropractic here in Louisville, Colorado. And if you need my help, I'd love to be of assistance for you. And we can start by scheduling a free virtual consultation. But first, if you need any more help, make sure you like the video, subscribe to our channel, and follow, because I'm always putting out helpful content like this.